Hello everyone. I hope you enjoy your time. Today we are going to speak about a medication, a new triple therapy medication for the treatment of type 2 diabetes. I am Dr. Hassan, Associated Professor of Clinical Pharmacology and Clinical Research. Okay, so our medication, triple therapy, combination therapy between three medication. As you can see, the brand name for this medication, we have two brand name available in the slide, but maybe we have more. When you maybe surf the internet, we have the Diacoline Max XR, then we have Trijardi for two different pharmaceutical companies. This medication consists of three drugs. Number one, empagliflozin, number two, linagliptin, number three, metformin. As you can see from this slide here, empagliflozin mainly affect the kidney. Linagliptin, the main side effect will be the GIT system, which means the intestinal. The metformin mainly affect the liver and secondary affect the GI system. Okay, so this medication comprises of three medications, and the end result of this combination therapy is to regulate the blood glucose, regulation of glucose homeostasis, to control blood glucose. As you can see here, we have empagliflozin work on the kidneys, as we mentioned that. Then we have linagliptin work on the GI system. Then we have metformin work on the liver. So you can see here we have three medication. These three medication work on the three different organs: kidney, liver, and intestine. And this effect maybe present synergistic effect, adjunctive effect. Start with the first medication in this therapy, triple therapy. We have metformin. MOA stand for mechanism of action. How the metformin work? As you all know, that metformin belong to the big one-eyed groups, big one-eyed class. The main mechanism of action, primary action of metformin, the main action will be on the liver. The metformin activate the enzyme called AMP enzyme. This AMP enzyme kind of protein kinase. This enzyme responsible for inactivation or inhibition of gluconeogenesis. So the situation here will be as follow. Metformin activate the enzyme protein kinase, AMP protein kinase. The activation protein kinase inhibit the gluconeogenesis. This will lead to the decreased glucose production. So decreased glucose production in the blood will be associated with the decreased glucose level. So this is the purpose of this, maybe the main mechanism of metformin. Other research found that metformin also has other effects, such as increased glucose uptake, increase insulin sensitivity. We can maybe say this one is like equal to the decreased insulin resistance. And increase fatty acid oxidation. And the last one, decrease intestinal glucose absorption. Some study found that by decreasing intestinal glucose absorption, this may be associated with the decrease glucose and decrease weight. Okay, so some studies suggest maybe metformin may decrease weight. Other studies said metformin has neutral effect on the weight. Okay, moving to the empagliflozin. Empagliflozin, this medication work mainly on the kidneys. We need to remember that. So empagliflozin work on the kidney. Which part of the kidneys? We have a specific part in the kidney. This part called proximal convoluted tubules, and we call this one BCT. So this medication inhibit a transporter called SGLT2, sodium glucose transporter 2, which is available in the proximal convoluted tubules. You can see it here. This medication inhibit this transporter, and this will lead to the excretion of sodium and glucose in the urine. So the result will be increased excretion of glucose in the urine, and this will lower blood glucose in patients with type 2 diabetes. Okay, potential mechanism. So the advantages of this maybe combination therapy, 3-in-1 medications, maybe mainly focusing on the empagliflozin. Empagliflozin has the advantage of cardiorenal benefit, cardiorenal effect. Number one, according to the study published by EMBA-RIG outcome, they found that empagliflozin reduce A1C, empagliflozin reduce weight, reduce uric acid, could be maybe added value in patient with added value in patients suffer from gout, and reduction visceral adiposity. In addition to these effects, they found also empagliflozin has maybe effect on the blood pressure. Empagliflozin decrease blood pressure, and empagliflozin has a diuretic effect and sympatholytic effect. So decreasing sympatholytic effect, diuretic effect, and decreased blood pressure. On the humoral effect, the important one on this medication, they found this medication affect the renin angiotensin aldosterone system. This is the important one, a pure energetic and provide energy to the main organs such as heart and kidney. Okay, this is a study published in Science Direct. As you can see the citation here. But this study may be talking about the potential mechanism involved in cardiorenal benefit of empagliflozin, and you can see this medication increase free fatty acid, increased level of ketones, increased release of glucagon, decrease preload in the heart, protect the heart, inactivate renin angiotensin aldosterone system, increase uric acid excretion, increase sodium and water excretion. This will lead to the decreased blood pressure. And another mechanism for decreasing blood pressure by affecting the sympathetic nervous system. So we have several mechanisms demonstrate the effect of empagliflozin. Okay, a study published by at the Circulation Journal, one of the most important with a well-known impact journal, Circulation, study the effect of sodium glucose transporter inhibitors, including empagliflozin. In this study, they found that you can see here the group of medication including empagliflozin. Including empagliflozin, they found this medication, the end result will be increased ATP, that means increased energy, and this energy will be provided to the heart and to the kidneys. For this reason, they found that empagliflozin decreased risk of cardiovascular death, and this one associated with the empagliflozin. Okay, we're done with the empagliflozin. So we already discussed the metformin. We discussed empagliflozin. Then with the last medication in this combination therapy, linagliptin. Okay. Okay, 3 medication. The last one here, linagliptin. How this medication work? When the individuals or a person take lunch or like food, when you have food or lunch or meal, our body will release the hormones or like proteins, and this protein will be responsible for the activation of enzyme and formation of some protein, and this protein called incretin protein. Okay, incretin protein, this will enhance the action of a GLB1 and GIB protein. So this one may lead to the activity of this protein or this incretin. We have it in the next slide, and we ask what is the action of incretin protein. So incretin protein has two main actions. We have more than these two actions. We have maybe 4 or 6 action of or effect of protein. We can speak about that later on. The issue here, when you look on the pathway of the glycoprotein or incretin hormone, incretin proteins, we have another enzyme in our body called DPP4, dipeptidyl peptidase 4. This enzyme responsible for metabolism of incretin. This one responsible for metabolism of incretin, and the end result will be inactivate of this protein, glycoprotein. So the medication linagliptin, mechanism of action of this medication, linagliptin inhibits, as you can see here, linagliptin inhibit the DPP4 enzyme. This enzyme responsible for metabolism of GLB1, and the result, when you use linagliptin, the result will be increase or prolong activity of GLB1. So the situation here, we have increased activity of GLB1, enhance the activity of GLB1. So now we understand how linagliptin affect the human body. Okay, linagliptin, we consider that this medication like DPP4 inhibitor. This inhibitor decreases degradation of incretin hormones, including GLB1 and GIB. The result will be stimulate insulin biosynthesis and secretion. So insulin will be enhanced and increased. On the other hand, the glucagon will be decreased. So what they found later on, linagliptin has dual actions, has two actions. Number one, okay, so increase insulin. Number two, decrease glucagon. So the end result for the using linagliptin, they found linagliptin regulate blood glucose. So this is the end result, the important result for this medication. Linagliptin regulate blood glucose or homeostasis. As you can see here, linagliptin is available in several doses. For example, we have 5, 2.5, 1,000, 10, 5, 1,000, 12.2.5, 1,000, 25, 5, 1,000. So linagliptin available in several doses. In this case, this gives us flexibility to choose which dose appropriate to your patient. So we can start with the low dose treatment, or like medium dose, or like moderate dose, or high dose. So we have the ability to choose between these medication. Okay, low dose, medium dose, moderate dose, high dose, depends on the patient need and requirement. Okay, this study published by the Behringer Ingham and Will Impact Journal, and you can see here the Trijardi XR, which may be equal to the triple therapy medication, and Trijardi here again, and another brand name, the Diacoline Max XR. Okay, compare with the empagliflozin 25 milligram, empagliflozin 10 milligram, linagliptin 5 milligram. You can see that two color here, the blue color line, the blue line represent Trijardi. So this is a Trijardi here. XR. So the Trijardi XR, you can see here, more effective in lowering A1C, according to the study published by the Science Direct. So Trijardi more effective than empagliflozin alone or linagliptin alone in lowering A1C. Okay, comparing again between Trijardi in different doses, compared with the empagliflozin alone, empagliflozin and linagliptin. You can see here what we have is like decreasing A1C more effectively compared with the other medications. So we can see here empagliflozin, the triple therapy, this combination therapy, more effective in lowering glucose level, and the end result will be control blood glucose. The same will be applied to the combination. They said here that this combination therapy is more effective, twice more effective than individual therapy compared with the dual treatment. So the triple treatment here, the triple treatment more effective than dual treatment. So when you talk about dual treatment, we have here empagliflozin plus linagliptin. So this dual therapy is less effective. Triple therapy more effective, like 2 times, as you can see, 60% compared with the 30%. They said this triple maybe combination therapy, 3-in-1 medication, more effective twice than the dual therapy. Indication and uses. This medication, this maybe combination of therapy used for patients with type 2 diabetes. This is great. So when you prescribe this medication to your patient, this will control blood sugar, number 1. Number 2, and the important one, they found this medication decreased risk of cardiovascular death due to the empagliflozin effect. So 2 things. Number 1, this medication control blood sugar. This medication decreased risk of cardiovascular death, and especially if you know diabetes mellitus is closely related to the cardiovascular disease. So when you prescribe this medication to your patient, we need to explain that this medication not only control blood sugar, this medication also decrease risk of cardiovascular death. Limitation. This medication is not recommended for patients with type 2 diabetes. This medication not recommended for patients with ketoacidosis, diabetic ketoacidosis. We have no studies about using this medication in patients with a history of pancreatitis. So we don't use this medication for those group of patients, type 1 diabetes, ketoacidosis, pancreatitis. This medication maximum recommended dosage for the patient will be 25 empagliflozin, 5 milligram linagliptin, 2000 milligram metformin. This medication prescribed once daily in the morning with the food. So food may be recommended to take this medication with the food or with meal. Individualized, this one meaning important issue for us when we talk about individualized, because we have, as we discussed in the beginning, we have 4 doses for this medication. We have low dose, we have moderate dose, medium, moderate, then we have high dose. So according to the patient, for example, you can start with low. If the patient need to control blood sugar, the dose is not enough, we escalate the dose until we achieve the target. So this is an important one. When you go to the control blood sugar, we need to escalate the dose until we achieve the control for blood sugar. Okay, patient with renal impairment or renal failure. If the patient glomerular filtration rate EGFR less than 30 milliliter per minute, or patient on dialysis, so two cases, EGFR less than 30 or patient on dialysis is not allowed to prescribe this medication. This medication is considered like contraindicated. Here we have another study that said if the EGFR less than 45, they don't recommend to use this medication. So here we have the languages with the patient. Here we have strict language here. Don't use this medication if the EGFR less than 30 or patient on dialysis. Here we have question mark. We need to decide, shall we use it or not? So the study, they said not recommended to use it in patient with less than 45 EGFR. Okay, in a pregnancy, we don't recommend to use this trouble therapy, and during pregnancy, not recommended during breastfeeding, not recommended in children or population less than 18 years old, geriatric populations. The important issue with the geriatric populations, metformin may increase risk of lactic acidosis. Therefore, we need to start with lower dose. So with the geriatric population, we need to start with a lower dose. Talking about renal impairment, we already covered this one, and we have the maybe confirmation about that. When you have EGFR less than 30, we don't recommend to use it, or consider like contraindicated, not allowed. Patient with hepatic impairment, this medication not allowed to use it. So hepatic impairment, renal impairment, pregnancy, nursing, pediatric less than 18 years, this medication is not maybe recommended for those group of population. This medication contraindication, like summary: metabolic acidosis, ketoacidosis, dialysis, end-stage renal disease, severe renal impairment. So this one not allowed to prescribe. Severe renal impairment, ESRD, dialysis, metabolic acidosis, and diabetic ketoacidosis. Okay, so here we have to be careful and warn the patient and take precautions because metformin study found metformin increased risk of lactic acidosis. When the patient maybe undergo the iodination contrast, we have to be careful about that. We need to discontinue this medication during the iodination contrast imaging. If the patient suffers from hepatic impairment, we have question mark and not recommended to use. If the patient alcoholic, depends on alcohol, we have to be careful about that because there is increased risk of hepatotoxicity. Okay, interactions. In reality, we have a huge amount of information about the interaction, but I brought something maybe in summary here. For example, they found this medication, if used with the topiramate or acetazolamide, there is increased risk of lactic acidosis. We don't recommend to use this medication with alcohol because risk of hepatotoxicity or liver damage. There is a potential volume of depletion if you use this medication with a diuretic. Diuretic increase excretion of sodium and water in the urine, and this medication, our medication, trouble therapy, Trijardi and Diacolin Plus, increase sodium and water in the urine, and this may lead to the volume depletion, and that means decrease blood volume. So when you talk about decreasing blood volume, we need to remember blood pressure is like equation between cardiac output multiplied by peripheral resistance. Cardiac output mainly related to the blood volume, and if the blood volume decreases, the result will be decreased blood pressure. Here the patient may suffer from hypotension, so the result will be here hypotension. So there is a risk of hypotension. For more information, we recommend maybe the audience or the reader or the healthcare provider to read the full drug prescription information. Adverse effect, most common adverse effect, some patients may suffer from upper respiratory tract infection, urinary tract infection, nasopharyngitis, diarrhea, constipation, headache. This is around 5%. Consider like important to notice that. We have some rare situation such as genital mycotic infections, hypersensitivity, pancreatitis, rare side effect. For more details, we recommend to read the full prescription drug information. Okay, at the end of this lecture, we have takeaway message. Number one, this medication kind of combination treatment between 3 drugs, empagliflozin, linagliptin, metformin. So we have 3 combination of treatment. This treatment work in synergistic effect, help each other, assist each other to control blood glucose. So the purpose of this combination therapy to regulate blood glucose with a normal level in patients with a type 2 diabetes. Okay, another advantage for this medication available in various doses, and this various doses provide flexibility to allow the healthcare provider to select the appropriate dose for each patient. So it depends on the patients. We have flexibility to choose which doses will be appropriate to your patient. Okay, thank you so much for your listening. I hope this lecture will benefit everyone who maybe see this lecture or watch this lecture, and enjoy the rest of the day. Goodbye, everyone.